Hey, it's Scott. And in this week's Give Me Five, I'm again joined by Wendy, who is an epidemiologist from the Florida Poison Control Centers. And what we'd like to quickly touch on this week is all things THC, otherwise more commonly known as marijuana.
So we've been seeing a lot of calls at the Poison Control Center about a lot of different variations on this theme of products derived from marijuana or cannabis. And so we've been able to work with our colleagues around the country where legalization has happened a few years ago and sort of learn from their experience. And so what we noticed was, in terms of toxicity, what was really driving the problem was actually the edible formulations, which tended to be very strong, and the dosage was a little complex. So initially these products would come out and there'd be like a cookie and the dosage would be like a sixth of the cookie. So I don't know about you, but I've never eaten a sixth of a cookie. It's more likely for me to eat 6 cookies. So of course you can see that people can very easily overdose. And THC is pretty potent. Even from the plant marijuana, we're seeing much more higher concentrations even in the plant formulations than we did back in the 70s and even the 80s or 90s. So it turned out for children particularly, we would see kids getting into these edibles, getting quite sick, presenting in the emergency department, and in some cases needing intensive care. And the families are just shocked. And so we've been out in the community letting families know that there are risks associated with these products. If people are choosing to use even medical formulations of marijuana that are THC, that have THC or Delta 9, that there are potential risks. So they want to secure their medications, just like any other over-the-counter or prescription medication, that products derived from marijuana need to also be secured.
And she was describing securing medications, and in this regards, it also literally means securing brownies and securing edibles.
Yeah, it's surprising. People, they don't think in terms of that, right? Right now, I think we have a kind of rosy glow around products from marijuana. We're really excited about the potential of different, using marijuana derivatives to treat different conditions. We still don't have a lot of research on this yet, unfortunately, because of the federal ban. So I think sometimes people let their guard down. Here in Florida, we have a lot of older adults who are seeking out the products to treat pain or anxiety or insomnia, but there may be grandchildren in the home or visiting, etc., and those products can fall into the wrong hands. So the Poison Control Centers are there to assist immediately for free, confidentially, and we can walk the caller through sort of what the risks might be, what symptoms we would be looking for, and of course making sure that family gets help if needed.
So with that, when it comes to all things THC, otherwise known as marijuana, some of y'all remember years ago there was the reggae song that simply was entitled Legalize It. And with that, across the country, this is becoming far more commonplace, whether it's for medical or for recreational use. It's out there. And if adults are using it nowadays, especially in kids, they're going to get a hold of it. And therefore, with all things poison, prevention, even when it comes to things such as edibles, gummies, or a brownie, really appears to make a difference.
No, absolutely. And some states have done a lot with it. I think a little more than we have here in Florida, in the sense that they've required single dose packaging, right? So you're not getting that brownie that is multiple doses, right? And so I think that's a good approach, so that each dose is individually packaged. In another state too, I know of at least one state that says it needs to be colorless, right? It can't be colorful so that it looks like a candy. That's another way that we can make it a bit less appealing to children. And again, we want people just to have a sense of the potency of these products that they're bringing into their homes.
It's a medicine. Just like anything else, it's a medicine.
And we go beyond the cabinet lock these days. So, we're not just worried about toddlers. Actually, we really advocate medication safety for all ages. So in our home, we have a metal-sided safe for our medications. It fits into a drawer. It's very easy. And I even have things like Benadryl in there and Tylenol because, I want to keep my whole family safe. So we want to sort of upgrade our game as our kids get older. And this is also important on issues of self-harm, right? So we want to make sure we recognize all the different reasons people might become poisoned.
So from Miami, thanks y'all. We'll see you next week for the Give Me Five.